Hi everyone, my name is Alexa and welcome to Nurses Notes 101. Today we'll be talking about peritonitis, also known as hot belly. So, to start off, peritonitis is inflammation of the peritoneum, which is the sac that holds multiple organs in the stomach. So, this is usually caused from bacterial infection in the blood or associated organs. Associated organs in this instance means uh, gallbladder infections, colon infections, small intestine infections, anything inside the peritoneum or actually externally in the abdomen as well that could cause inflammation and infection. Causes of peritonitis and risk factors include abdominal surgery, so any sort of invasive procedure performed in the abdomen can cause an infection there. An ectopic pregnancy can also cause peritonitis. And one of the most likely causes of peritonitis is perforations. These perforations can be due to traumas, like a gunshot wound or a stab wound. They can be due to diverticulitis that is perforated, so that outpouching in the colon. It can be due to an appendix rupture, which will cause pretty widespread infection in the abdomen or a perforated ulcer. Signs and symptoms of peritonitis include increased pulse rate and increased blood pressure, dehydration, pale colored skin, minimal bowel sounds. And now we're getting to the signs and symptoms that are pretty classic for this disease, which include abdominal distension and rigidness. So the patient will complain of a lot of abdominal pain and their stomach will be tight or taut to the touch. And a lot of times these patients also have rebound tenderness. So if you are to push on their stomach, they don't feel the pain right when you push, but when you take your hand away, that's when they will have immense, like generalized abdominal pain. They usually have a pretty high fever, over 100 degrees Fahrenheit, and accompanied by nauseousness and vomiting. The nursing care of a patient with peritonitis includes IV fluids and electrolyte balances. Sometimes these patients can have a low potassium or a high potassium, so we want to make sure to treat those accordingly. Treatment of GI distension with bowel regimens like Senna, different laxatives that can help the patient move their bowels. And we also wanted to decrease the rate of the infectious process by drawing cultures, seeing where the infection's coming from, giving antibiotics, potentially giving steroids, depending on the source of the infection. Complications of peritonitis can include pressure injuries due to immobility issues from the pain in the abdomen, and more severely can include pulmonary and fluid balance effects. So this means a lot of times with peritonitis, we can give excess fluid. If for some reason we're giving too much fluid, or the patient has heart failure or kidney disease, and say they're not filtering out the fluid as well as someone who doesn't have those things would, we can actually put them into respiratory distress. So we want to make sure that their lungs sound clear, and that we have an adequate fluid balance for them and aren't giving them too much fluid. Okay. Thank you so much for listening to my channel. I hope I taught you something, and please hit the like button and subscribe.